Hi, everybody, and thanks again for joining today's webinar. I'm going to get things kicked off now, and we may have a few people join as we're going, but just to let all of you know that this webinar will be recorded, and we will be emailing all registrants a copy of the slide deck that we are presenting with. So any information that we don't spend enough time on that page for you to absorb it all, we will be forwarding all of this information to each of you directly, so at your leisure you'd be able to review it. I'd like to start first by introducing myself. My name is Adam Lombardi, and I am the Director of Sales and Business Development here at Amazing Charts. My role, obviously, with the sales department is overseeing all of our account managers and sales executives, who I would imagine most of you have dealt with either recently or in the past when you joined our community. Today our focus is going to be on Amazing Charts practice management and how it can increase the productivity and your office workflow. We'll be going over a little bit of the PM overview, and then I'll be passing along the controls to Katie, who will be going over a product demonstration and a little bit of a deeper dive. I want to be upfront in telling you that this will be a high-level overview of the product, and if you or any of your staff members would like a deeper dive and perhaps a one-on-one dedicated demonstration of the product for you and the way that you would need to use it, you can feel free to reach out to our sales department, and we would be able to schedule that with our practice management sales specialist for you. So the background of Amazing Charts practice management, to let you know where it originated. For years, obviously, our EHR has been rated as one of, if not the top electronic health record systems on the market. We just recently got the #1 ranking again from WebMD and Medscape. And also, along with our ranking being so high, we have prided ourselves on the fact that our pricing model is set at the lower end of the spectrum. So when we sought to create a practice management and reduce the double entry that does sometimes occur with an interface product, we needed to keep that target in mind. We needed to find a way to make the product very functional and easy to use so it would not contradict the way that our electronic health record is received in the industry, and also a way to keep that pricing model in line with our electronic health record system so you don't find yourself with an affordable solution on one side and something that breaks the bank on the other. We've done a lot of research comparing market analysis from other companies and the products offered, and we've made it a point to find ourselves just below the pricing of all of our competitors to make it easier for you to incorporate this type of a solution in your practice without hurting your wallet. As far as who should be using Amazing Charts practice management, just so we understand, this is a software and it's not a service. And in saying that, what I mean is that the practice management will give you the ability to electronically submit your claims through the clearinghouse and receive electronic payments. But it's still software. It won't be doing this on its own. You will need somebody at your office that has the capability and understanding of medical billing and or practice management software to efficiently use this. The idea that I like to give people is it's similar to a do-it-yourself project at home. We would provide you with the toolkit and some basic instructions and training, but from there, the lifting would be on your end as far as processing your claims efficiently and being able to follow up on claims that you may have issues with due to coding errors or human error with something that was entered incorrectly from your end. Okay, so eligibility is one of the basic things that practice management will provide for you. And with it being real-time eligibility, the benefit of that is you will be able to check a person's insurance eligibility when they come in and check in the office. So you know that that person that is there for today's encounter or today's visit, their insurance is valid, and that you're not going to run into any issues on having the claim reimbursement. If in fact it comes back as they are ineligible for insurance, it would give you ample time to discuss the options with the patient while they're in the office, possibly a pay out of pocket visit, whatever you may be able to offer from your practice. The customizable schedule is something that we made it a point to work in because over the years we've had many of our Amazing Charts users request if they could make any changes to the schedule, and a couple of the changes that they really wanted to try and incorporate had to do around color themes where they could have different color codes either per provider or per status of the visit. So now if you have a multiple provider office, you could set up one provider pink, one green, one blue, one yellow. So at a quick glance, you'd be able to tell who has which appointment coming up next. Another way that practices are choosing to use the color coordination is for the stage or status of the patient's visit. So they could use something like green that they're in the waiting room waiting to be seen. It could be orange that they're in the exam room, and it could be red that they're at the checkout. As far as data integration, this is one of the big benefits of choosing to go with an integrated product versus an interface product. The data integration, anything that you create a change in Amazing Charts or in Amazing Charts Practice Management, that change is going to be reflected in both places. You're not logging into two separate software products. You're logging into one. Where that's going to come into play compared to an interface product is if you have a patient that changes address. If you're using a third-party practice management, it would be your responsibility to make that address change in their demographics in both Amazing Charts, EHR, and the practice management that you're using from a third-party provider. With ours being seamless and integrated, all of those changes will happen in real time and will reduce your double entry that you are seeing today. As far as the clearinghouse that we use is Claim Remedy. And the clearinghouse is what gives you that ability to electronically submit these claims to all of the insurance payers and also be able to look through the portal of the clearinghouse and see what's going on with your claim status. So it'll give you real-time visibility into where your payments are in process and what you can expect to be receiving shortly. And here's some testimonials from a few of our users already. These, rather than read them to you, we will be submitting these to you. And again, if you click on the link at the bottom, it should bring you to the full case studies that these quotes were taken from, so you can read some of the success stories of our established clients. And this would do the pricing. So as far as the pricing, I touched on this a little bit about trying to keep our model, below the competition, but also at a point that it's affordable and it seems like a strong return on investment for our clients. The way that we've come up with that is similar to our pricing on Amazing Charts. We base this off of a provider count in Amazing Charts. So practice management for the practice would cost $249 per month. This is unlimited claims and all the reporting features, the eligibility check. In the case that you do work at a multi-provider practice, rather than charging $249 each, what we have done is for multi-provider practices, we would add an additional $99 per month for each provider level person that you have in Amazing Charts. The annual subscription, it's a 14-month contract from the start. The reason that it is 14 months is we give about 2 months for the implementation and onboarding. The average time on onboarding runs anywhere between 8 and 12 weeks. We do not bill you during this implementation period. The billing cycle is scheduled to begin either the day that you are installed and set up with practice management or 14 weeks after you have entered the implementation process. The reason we chose 14 weeks is because it exceeds the amount of time that we actually need to get a practice up and running. But part of getting a practice implemented and onboarded requires the practice availability for trainings and some assistance with building out their own tables. So we want to make sure that we have the practice invested as far as understanding the time that they will need to put forth to get this up and running. The billing would start, like I said, when it's installed or after 14 weeks, and then there would be 12 consecutive monthly billing installments under that contract term. And again, if you do have any questions, you can see the number at the bottom there for sales. It's 866-382-5932, and sales is at extension 2. Here's an example of one of our current clinical advisory board members that has switched to our practice management solution. We're looking at saving him quite a bit of money. Obviously, you can see his bottom line is about $9,000 per year less than what he was paying with a third-party practice management. And beyond saving that $9,000 fiscally, the reduced double entry, it allows the staff to have more time to focus on some of the other things around the office that were left unattended because there was more entry for his staff members to be working with. Okay, I'm going to pass it along to Katie, and she will give you guys an overview of the practice management software.
Good afternoon, everyone. Thank you again for joining today. My name is Katie Phelan. I am one of the trainers here at Amazing Charts. I've been here since May of 2015. Look forward to working with some of you, if not all of you. So now I'm going to go ahead and give you a high-level overview of Amazing Charts practice management. And like Adam said earlier, if you are interested in getting a more deep dive, we do have a demo specialist that would be more than happy to do one of those with you. And all of that information will be sent to you after this session. So I want to get started with talking about the integration between Amazing Charts EHR and Amazing Charts PM. With the integration, you do not have to worry about signing in separately to the practice management. You will use the single sign-on process, and you will easily navigate over to practice management if and when you need to get into the practice management. There are multiple ways of doing everything throughout the product, and you would learn all of that, of course, during the training. So we set it up that way because we understand with most practices, everyone has a different preference and a different workflow. So we kept that in mind when we designed not only the integration, but how you actually navigate around the system. So the integration is really comprised of 3 pieces: the patient demographics, the schedule, and of course the charge information. So all of the patients that currently exist in your Amazing Charts EHR would automatically be accessible to you once you're installed with Amazing Charts PM. And if you needed to update a piece of the patient's demographics in one system, it would update in the other. Of course, keep in mind that the practice management is now your billing system, so there will be certain areas of the patient's chart that will exist in one system and not in the other, but that's just the way it goes because your AC EHR would continue to be your clinical system, and AC practice management would be the billing side of the house. So you can see on my screen here up at the top, I have a direct link from here into the practice management. While you have Susie Smith in the office, of course we recommend that all new patients and existing patients are managed from the practice management area of the system. If there are any staff members that, for one reason or another don't find it necessary, to go to the PM, they would still be able to see any of that updated information if they were to pull the patient's demographics over on the EHR side. As for the schedule, same thing. We kind of took it into account that, not everybody may want to go over to Amazing Charts Practice Management in order to see, who's on the schedule for the day. So you would still have the ability to see who is coming into the office. And I'm bringing that up right now. So right here, you can see on my screen that all of these patients that are currently booked in Amazing Charts, or displaying on Amazing Charts, were booked in Amazing Charts Practice Management. Because again, from the workflow point of view, we do recommend that all appointments are scheduled and managed over on the practice management side. But of course, if the doctor or maybe the medical assistants or nurses don't necessarily need to go over to the practice management to see who's coming in for the day, you'd be able to get that information in here. And then, of course, the charge information. So the way that it works is when the provider signs off on the patient's encounter in Amazing Charts, they will have the ability to do some of the basic coding for that patient's appointment, which is really convenient because it will help the biller to get it started, and it takes away having to use those paper encounter forms. So you'll get to save some trees and some ink as well. And all that's really required of the provider is to click off a procedure code, and when they click off the procedure code, the diagnosis code from the assessment automatically gets attached to the CPT that the provider selected. And there is a way in Amazing Charts that you can customize this screen here so it could mimic your paper encounter form. And then when they sign off on that patient's encounter, it's then going to transmit the details of that charge over to Amazing Charts Practice Management. And then from there, the biller is going to have the opportunity to go in and review that patient's information for the day right within their chart. They'll be able to make any corrections that are necessary, maybe add modifiers, add or remove diagnoses prior to billing. So now let's go over to Amazing Charts Practice Management. We're right now looking at what we call the home screen of the practice management, which is also known as front desk. So the way that practice management is broken down is to mimic the typical workflow in an office. So everything is broken down into different categories. The front desk, this is where you'll find all the front desk functionality. And we like to think that it's pretty straightforward and user-friendly as far as picking up on how to use the system. Of course, during the training process, as you're learning the product, you will have the opportunity to get some hands-on practice prior to actually going live. So you'll be able to register some dummy patients, book appointments, and even do some of the basic billing functions. So here you can do everything that a front desk person would need to do, which would be searching for patients. There's multiple ways that you can search for patients in the practice management. So if you like to look for patients by name, that's not a problem. Date of birth, account number. We have numerous options for searching for patients. And throughout the product, we have hyperlinks that then allow you to drill in to more information for that individual patient, or depending on where you're working, just more information pertaining to that screen that you're on. So for Dean Winchester, I'd be able to easily launch his chart right from here after searching for him. And then you have the option to manage appointments 2 different ways in Amazing Charts PM. You could do it from the Manage Appointment screen where you can see all of the patients that are coming in, the current status of their appointment, why they're coming in, who they're seeing, at what location and time, and then you can perform different actions on their appointment right from here. You can launch their chart, view details of the appointment. As far as eligibility goes, there are a few different ways that you can handle eligibility in Amazing Charts Practice Management. One, which is probably the most popular one, is the automated electronic eligibility checks. So for any patients that are booked on the schedule, the system will do an automated check of their eligibility, and you can schedule when that eligibility is performed. If you want it to be the morning of, day before, 2 days before, it's up to you. And that's something that you will work with your practice management implementation specialist on during your implementation. Otherwise, of course, there are a lot of circumstances when you're going to need to do an on-the-spot eligibility check. So this is one of the multiple places in Amazing Charts Practice Management that you can do that manual check. And then you can see over here that at a glance, you would be able to see the eligibility status of each one of your patients coming in for the day. And you'll notice it is in blue. So it means if I need to go in and get more information on why this patient is not eligible, I could drill in here and see that information. Or if the payer that was checked provides benefit information from that check, so copay, coinsurance, deductible, authorizations, etc., I could drill into the eligible link and get that information for my patients. And then you can mark the different statuses of the patient's appointment. So from here, you can mark that a patient has been checked in, that they no-showed, which we call missed, or that they checked out, which we say seen. And all that information would be updated instantaneously in the status column. And then down here, the outstanding recall summary. So this is an optional feature that a lot of people take advantage of. If your practice doesn't always book follow-up appointments, you can set up a reminder or a recall for your patients, and then those patients will be flagged by recall reason right here on the front desk, and then can be managed by somebody in the practice, and they can run a list of those patients that need to come in within a certain amount of time, and they could call them from that list. They could send the postcards or letters, whatever your preference is. So I'm going to go into my test patient now. I'm just going to give you a quick look at what the chart looks like. So at first glance, you may be saying to yourself, wow, there's a lot of information on this chart, and it's a bit overwhelming. But I actually see that as a benefit, and after our clients have been on the system and get familiar with the whole navigation of ACPM, they feel the same way. Because it's really a one-stop shop for your patients. You get everything that you need to know and see about your patients right here on one screen. You can see their demographic information, the information that you need from a front desk perspective as far as copays and coinsurance information, their date of service history, any alerts that have been set up by the practice, and you can color code those alerts also. Any upcoming and historical appointments for the patient, referrals, prior authorizations, those recalls that we just discussed, and even claim history and statement history. So you'd be able to see all the times that a claim was generated for the patient, or if they've received a statement. And you'll notice that there's blue hyperlinks everywhere, allowing you to drill in and get more information for the patient regarding that pain. So you'd be able to answer statement questions from here, check on referrals and authorizations, do billing. You could even launch the appointment scheduler screen from here. So I mentioned before about all those different shortcuts that are throughout the system, because we want you to get your tasks done as quick as possible. So I'm going to go into the appointment scheduling screen now, because this is a pretty exciting screen for a lot of people. This is where you get to see some of the color coding at work. And Adam explained earlier that you can color code appointment statuses. So when a patient is marked checked in, they could be green. When they're checked out, they could be marked red. Even patients that miss their appointments can be color coded. You can color code eligibility statuses. So if eligibility is critical for your practice, you can mark all of your critical patients red or orange. And when you look at the schedule, you would be able to easily see if you have a lot of patients coming back with ineligible responses. You also can see, and you may not be able to see too great because of the color coding that I'm using, but there's also icons that display on the actual patient's appointment that represent their eligibility status. And then you can do checks and rechecks of eligibility right from the schedule. You can also color code appointment types. So your follow-ups could be one color, your new patients could be another. You can color code provider headers. You can color code available and unavailable time slots. And you have options when it comes to viewing your schedule. You can view your schedules one day at a time, or you can view a schedule for a provider 5 days at a time, 7 days at a time, or even a month at a time. You can book appointments multiple ways. You can use all of the navigation tools right on the schedule here, or you can have the system do the work for you with a bulk search. And the system would provide results back, and then you could go down that list until you find the day and time that works for the patient, and then simply book the appointment. And there's further customization that you could do with your appointments. You can, specify what your time increments are, your start and end time, and even how many resources that you want to view at a time on the schedule. And that would be, more important for larger practices where, you may not want to see 6, 8, 10, or even 20 columns of providers' availability on one screen. And from a front desk perspective, you can see that I can customize as well what information displays on the appointment. So I can get it so that if I hover over a patient, I can actually see date of birth, age, home phone number, their appointment note. And then when I click on a patient, the system will actually provide some more demographic information at the bottom here for me. Otherwise, obviously best practice is to launch right into their chart and review, make sure that their insurance information hasn't changed, maybe look at some of those alerts that may be set up for you. If that's the case, I can right-click on any patient's appointment and launch their chart right from here. I can also a new patient right from here. And then once I go to another screen that I navigated to from the appointment scheduler screen, when I'm done in that screen and I X out, the system is automatically going to route me back here because this is where I started. So there's a really nice check-in, check-out flow for your front desk staff in Amazing Charts Practice Management. Everything that they would need for that patient pretty much exists right from these screens. So now let's talk about some of the billing aspects of the system. So I mentioned before that when it is installed and your provider signs off on a patient's encounter, that information comes over into the practice management for the biller. And all that information is available right from the chart under the visit history. So all the biller really would need to do is go in, take a quick look at the information that came over from Amazing Charts, maybe make some slight modifications to it, because of course, you know, the provider is there to see patients, not bill. Add any additional claim information that is required. Save that information, and then move on to the next patient. And at the end of the day, we have a pretty straightforward batching process in the billing area of the system, where you'd be able to set up a criteria for that batch. So we take into account of the different needs of practices. Some practices have providers that maybe are still in the credentialing process, or if you're eager to get on Amazing Charts PM, maybe not all of your payers are approved yet for electronic claim submission. So we have all of these filters here so that you could filter out certain providers or carriers from your batch until you're ready to submit for them. And we still allow you to review the information that's going to be batched prior to batching it, to make sure that you didn't accidentally put in a claim to be submitted that you didn't want to. And then you can remove that claim or claims from your batch. And then we understand the importance of sending out clean claims. So you do validate your batches before they leave ACPM to make sure that all your ducks in a row, as far as having the patient's insurance set up properly, that there's a subscriber and the subscriber information has been entered, and of course that the patient information has been entered correctly. And then if you pass the validation, you click a transmit link, and then the system takes all of the claims in that batch and forwards it to the clearinghouse, which ours is Claim Remedy, for forward processing. And of course, you'd also be able to validate and print any claims that could not go electronic from here as well. So next what I'm going to do is I'm going to bring up our clearinghouse so that you can actually see the portal. All of our clients get direct access to our clearinghouse portal, and you get that the moment that you've signed on to ACPM. So when those claims are then transferred over to the clearinghouse portal, you would use a login to get into the website, and you'd be able to go in and look at your claim batches. And then you'd be able to see on the spot if there were any errors that resulted in the scrubber in the clearinghouse. And then you'd be able to view what those errors are. And there's a few different ways that you can work your claims in the clearinghouse as well. We take it into consideration that some people like to correct their claims at the clearinghouse level. Some people want to go back to the source, which in our case would be Amazing Charts PM, and look at their fix their claims from there. And I'm just logging back in because, like most systems, it does log you out after amount of time of inactivity. And I've been talking for a little while, so it kicked me out. And then you'd also be able to see how many of those claims from that batch were successfully forwarded on to the payer. Here we go. So if I click on the error column, I can get a nice error report to quickly see what different errors that I'm working with. And of course, you get trained on how to handle all these errors and what the different errors mean. And then I could also look at a report that shows me everything that was forwarded onto the payer successfully. And you can print or save any of these reports. And then, of course, you can organize your claims. You can archive them when you're done working with your batches. And you can even come in here and look at claims for a particular patient. So if you wanted to see what the claim status was for a certain patient or for a certain batch, you could do that as well from here. Because it will follow that claim all the way through the process, all the way to adjudication. It would tell you whether it was accepted, denied, paid, all of that. You would get that information right from within the clearinghouse portal. When the payer actually gets the claim and they want to acknowledge the receipt of that claim, which is known as a payer response report or a payer acknowledgement report. Some people call it one, some people call it the other. Those reports do come right into Amazing Charts Practice Management in the same screen where you batched, validated, and transmitted your claims. So you would get those acknowledgement reports that some of you may use to dispute timely filing. And then, of course, payments. Once you actually start getting paid by the payers, if you are enrolled for electronic remittances, which we highly recommend that you enroll for as many as you can, those will come into the practice management under the bookkeeping area. So this is where practices manage their payments. So you'd be able to come in here and confirm the receipt of your ERAs. And here's an example. And you'd always be able to get a detailed report of that ERA as well. So it basically looks like a paper EOB. And then if everything on that ERA matches what's in the system, so as long as nothing has been changed for that claim since it was originally submitted, in a matter of just a couple of clicks, you could have an entire ERA of $30,000, $40,000 posted in the system. So you can download and hit commit in just a few clicks. And then it will disperse all of the transaction details for those patients accordingly in the system. And then, of course, that information is available in patient ledgers and on reports in the system. And another thing to note is that because the claims, the payer response reports, the ERAs, and even the eligibility checks, all of that information goes to and from our clearinghouse, you will be able to get all of that information from the clearinghouse as well, if you prefer to look at information from within there. You'll see in the clearinghouse, in this drop-down here, I have an eligibility link, the claim file link that we were just looking at, ERA file, and response report. So the information is available within both systems. And then, of course, if you have any manual payments that you have to enter, that gets done on this screen as well. So from a billing perspective, or someone in your practice who handles the payment posting, I do everything right from bookkeeping. Down to working my unapplied payments by patient, if you work those in bulk in your practice. And then reporting, of course, after you're done all of these activities, you need a report on them. So we have a pretty good, I would say, amount of reports. As you can see, all of our reports are broken down by report type. And they have their own set of filter options so that you can customize the information on that report. Reports can be run by service date or transaction date. And we also have certain reports that you can run by payment date. You can run reports for different users or for different providers. And you can save all of our reports as well, so that if there's someone else in the practice that needs to review that report, or you want to know how you ran that report next month, all of that information can be saved. So just to bring up a couple examples of the different reports we have. We have the balance before closing report, or the deposit slip report. This allows you to see all your charges, payments, and adjustments. And this one's broken out by individual patient and transaction date. What's really convenient about our reports is when you run them, you see all of the filter options. You select it up at the top, so you know how this report is filtered by. And all of our, or most of our reports, have subtotals and grand totals, depending on how the information, again, was filtered. So we have reports for your front desk so that they can balance their co-pays at the end of the day. We have reports for your billers on the back end for their charges and their payments. You can run our reports by carrier, depending on how planned you want that information broken out. We have, I would say, a robust amount of AR reports, and all different ways that you can run those reports in the system. And then we have some patient reports that you can run as well, and appointment reports. In addition to the reports that are in Amazing Charts Practice Management, there are also reports that you can take advantage of in our Clearinghouse portal. So that is the demonstration for Amazing Charts Practice Management. I know it was a pretty high-level overview. So again, if you would like to have a more custom demo to your practice, please contact our sales department. You will also get some follow-up emails after today's session with the recording from today and contact information if you are interested in getting more information. So I'm going to go ahead and open up the floor to any questions that you have. It looks like a few people sent questions. Oh, it was just someone that had to leave early and they wanted to make sure they would get a recorded version, which they will get.
And just to follow up on that discussion, we will be reaching out to each of you guys personally one-on-one to find out if you do have any questions after you've viewed the slides at your own leisure, or again, if you do want to see a deeper dive into some specific features of the product that may be important to the way that your office flow works for your practice.
All right, so let's see. It looks like that we had one question come through. So this question's a little specific. How are payment adjustments done? So if I understand your question correctly, we do have different adjustment codes that we set up by default for all of our clients. You know, just those typical adjustment codes based off of the electronic claim codes that you get on your ERAs. Or you, again, can customize the different adjustments that you do in your practice. Because, you know, some practices do self-pay adjustments or, you know, have just different adjustment codes that they use internally that may not be universal. And all of that can be set up and customized for your practice, whether it's a credit adjustment, debit adjustment, transfer, etc. And that's one thing that a lot of our clients really like about the system is that during your implementation process, you will work with your practice management implementation specialist and, of course, get trained on how you can customize your practice management. You can customize payment types. You can really almost customize anything. But we do get you started with global payment types and adjustments, etc., because we don't want you to start off with nothing. Oh, one more. Sorry. I think everyone's probably having side conversations and then realizing they have questions. So this question is, how long is the implementation process? So that was something that Adam had talked about, I think, in the beginning, that it can be anywhere from really 8 to 12 weeks, or maybe even a little bit over that. It really just depends on, of course, your internal staff taking the time to get trained and dedicating themselves to getting trained on the PM. But also there are other moving parts that are happening at the same time. One pretty important moving part is the EDI enrollment and the ERA enrollment. You are personally assigned a representative from our clearinghouse that would help you through that process. We don't send you a bunch of paperwork and, you know, hope you fill it out okay. We actually have a rep from the actual clearinghouse that help you get your claim submission paperwork submitted to the payers, approved in a timely manner, and the same goes for your electronic payments, your ERAs. So, you know, a lot of carriers have different turnover times. Obviously, the governmentals take a little bit longer, but other than that, we can get clients up and running on the system, you know, as soon as possible. We usually say, though, you want it safely anywhere from 8 to 12 weeks. Great question. And another one. Would you work with my current PM system to move outstanding claims over? That's a really good question, and that comes up a lot. And I've actually worked for other PM systems, and I've really yet to come across a system that brings over billing information electronically because there are a lot of compliance issues with that when you're moving patient financials. So we do not bring over claim information. What we recommend, and pretty much other PM systems recommend, is that you have a hard cutoff date, which is your go live, when you stop submitting new claims out of your other system. And some people even maybe hold claims for a little while. It depends on how, you deal with your financials internally, if you can hold claims for a little bit. And they will enter all new claims out of Amazing Charts Practice Management, and they will just work their old claims out of their other system. Now, of course, there is a way that you can manually move some of your claims over. I know a lot of people will bring over patient balances from their other PM, but as far as, and doing any kind of electronic conversion of billing information, we don't do it, and most billing systems do not do that. But that's a great question. All right. Well, of course, if any other questions come up along the way, we have plenty of people on our end to answer them for you. So Adam, if you have nothing else, I think we could probably end the call and give everybody some time back in their day.
Sure, and just to add, I'm going to give everybody my direct contact info. As I stated at the beginning, you can always reach out to our toll-free number, and extension 2 will get you somebody in my sales department. The toll-free number is 866-382-5932. My direct extension is 3364 should you ever want to reach me directly or know that you're going to reach a live person. I do recognize a couple of the names of our attendees as people that I've worked with in the past, so hello to all of you, and I'm looking forward to meeting the rest of you at some point along your path and engaging with the practice management or just supporting you on the clinical EHR side.
Thank you, everyone.
Thanks, guys. Thanks, Katie.
Oh, you're welcome, Adam.
Bye-bye.